For my study, I chose to research a medical professional's knowledge and comfort level in the equipment removal in cervical spinal cord injuries. In recent literature, there has been a debate started that in regards as to who is the better medical professional to remove sporting equipment and when is the appropriate time to remove sporting equipment. The National Athletic Trainers Association published a position statement on the management of spinal cord injuries that states equipment should remain in place with the exception of the face mask until the athlete is in the hospital or a more controlled environment. But the same position statement also states that equipment should be removed by a trained personnel. Through extensive research, I was unable to find any other position statements, guidelines, or protocols in regards to equipment removal from any other medical profession. The closest guideline I could come up with was from the EMS community, that EMS and paramedics have educational experience in removing helmets in the field when dealing with motorcycle accidents. The overall knowledge of medical professionals in regards to equipment removal spans from knowing very much, as in the profession of athletic training, and knowing not a whole lot because there is no education in equipment removal in physicians and nurses education. My purpose statement was the purpose of this study was to determine the level of knowledge and comfort level of medical professionals with equipment removal during a suspected cervical spinal cord injury. My research question was what was the knowledge and comfort level of medical professionals with equipment removal during a suspected cervical spinal cord injury. My null hypothesis was there was no significant difference in the level of knowledge and comfort level of medical professionals with equipment removal during a suspected cervical spinal cord injury. The study design I chose to use was a quasi-experimental and a crossover study design. I chose the quasi-experimental because it allowed to control some of the threats to the internal validity, and also because there was, in the initial development of the treatment groups, there was no randomization. The crossover design was used because this allowed for repeated trials to occur throughout the study. There were 4 treatment groups made up of the same medical professionals, so no interdisciplinary cooperation was assessed throughout this study. I chose to use 40 participants from 4 different medical professions. 10 certified athletic trainers who specifically work in the collegiate or secondary school setting, 10 emergency medical technicians or paramedics, 10 registered nurses who specifically work in the emergency department, and 10 physicians who again specifically work in the emergency department. Instrumentation used, I used 2 different types of shoulder pads and 2 different types of helmets to represent the variety of helmets and shoulder pads used by many football players. The study was performed in a biomechanics lab using an 8-camera, 3-dimensional motion capture system that was set up to capture the head and torso movement in live models wearing properly fitted helmets and shoulder pads. The participants completed a total of 16 trials to account for all the possible combinations based on possible combinations of football equipment based on the shoulder pads and helmets used in the study. The participants, after completion of each trial, would complete a modified Borg CR10 scale to rate the level of difficulty in removing the equipment and also rate the difficulty in the tools used to remove the equipment. The methods. The participants were randomly assigned into pairs of twos within their respective medical professionals because, again, there was no interdisciplinary cooperation assessed in this study. A general overview of how to remove the equipment was performed for each different combination and was explained once to each pair and conducted by the researchers. The participants would perform the same combination of equipment removal 4 times because each person within the pairing would be rescuer 1 and rescuer 2 times for each equipment combination. Each trial was timed and recorded, and then the modified Borg scale was administered to each participant independently after the equipment removal combination was completed. The data analysis was that an average time was recorded in the removal of the equipment. There was a 10-minute limit. If the pair was able to remove the equipment within the time constraint, the trial was marked as a success. If they were unable to remove the equipment in the time constraint, the trial was marked as unsuccessful. The motion of the head and torso was analyzed. It was determined by subtracting the minimum and maximum positions for the head and the torso. The degree of motion was average for each trial within the pairing, and was also average for the overall of each treatment group for each individual medical profession. The analysis was conducted using a paired t-test with a level of significance of 0.05. The modified Borg scale was also analyzed using 3 1x4 repeated the ANOVAs with the Bonnefroni correction, and was used to calculate the means, the ranges, and the measures of variance for each of the scores for equipment removal and the tools used in the equipment removal process. The conclusions of the study showed that the athletic trainers were the most knowledgeable and confident in the equipment removal process. The athletic trainers demonstrated the ability to produce the least amount of motion in both the head and the torso, and the quickest time in removing the sports equipment. The EMTs and paramedics were also competent in removing sports equipment because of their background in removing helmets from motorcycle accident victims. The registered nurses and physicians were the least knowledgeable and confident in removing the sports equipment, mainly because they had very little education in removing sports equipment. The equipment removal often depends on the specific equipment worn by the athlete and the tools accessible to the medical professional. Removal of the face mask was the quickest, easiest, and produced the least amount of motion for all medical professionals when using the cordless screwdriver or removing the face mask from a helmet with the quick release mechanism. Traditional shoulder pads created the most motion of the head and also the torso because of the requirement to use the tilt technique and the all or nothing process to remove the shoulder pads and the helmets and the constant transition of stabilization. The ripcord shoulder pads produce the least amount of motion because it doesn't require as much transfer of stabilization and as much movement to remove the equipment, such as using the tilt technique. The athletic trainers, again, were the most knowledgeable, confident, and quickest in removing any combination of the sports equipment. And again, the EMTs and paramedics were also able to remove the equipment in a reasonable amount of time with least amount of motion of the head and torso. Recommendations based on the results of this study would be that a protocol for the equipment removal process in a suspected cerebrospinal cord injury needs to be developed. The results, again, state the athletic trainers are the most knowledgeable and confident in removing equipment. However, athletic trainers may not always be present at every sporting event, such as in youth football games. So other medical professionals, EMTs specifically, and the ED nurses and ED physicians should also be knowledgeable and well-trained in the equipment removal process. Knowing the equipment is also very important. As stated, using just 2 types of helmets and 2 types of shoulder pads is very small compared to the number of styles of shoulder pads and helmets that currently exist. So the more familiar people are with the equipment worn by their players, the more comfortable they can be with removing the sports equipment. Thus, the rehearsal of the equipment removal process before the season begins, the better prepared the whole sports medicine team can be. Athletic trainers and education is also a very important component. That athletic trainers should take the time to help educate the local emergency service squads and the emergency department staff that would be involved in their both in their sports medicine team, and would also be involved in the situation if a cervical spine injury occurred. And this also helps to establish stronger relationships between the medical professionals and allow for that interrelational relationships to develop. Application. Again, education is key because right now the results showed that there is a large gap between the education of different medical professionals in regards to the removal of sporting equipment. Helping to close this gap would ultimately provide the best medical care for the patients, because that is, above all, one of the most important things about being in the medical profession. But this also helps to show other medical professionals what the profession of athletic training can bring to the table and what we can offer to other medical professionals. What I learned throughout this study was that medical professionals involved with the care of athletes are not always well versed in all the treatments of various injuries. So each medical professional can bring something different to the care of an injured athlete. So ultimately, there should be a level of cooperation and a level of respect from all the medical professionals involved in the care of an athlete, so that the care of the athlete or the patient can receive the best care. So in summary, providing the best patient care is above all the most important part about being a medical professional. Equipment removal in the event of a cervical spinal cord injury during athletics can further complicate an injury if removed incorrectly. Having proper knowledge, confidence, and training is essential in the equipment removal process. And overall, a protocol should be reached about who is the most qualified in removing the sports equipment and when is the most appropriate time to remove the sporting equipment. Thank you.